Atara is a company that is focused on development of T-cell immunotherapies and specifically off-the-shelf next-generation allogeneic T-cell immunotherapies. The company has three pillars at this time. One is focusing on EBV-associated disease. Epstein-Barr virus is a virus that 95% of the population have, and it leads to different types of diseases that we're targeting through an allogeneic T-cell approach. Second pillar is studies in multiple sclerosis, where we believe that multiple sclerosis is potentially an EBV-associated disease. Not as big at ASH this year, obviously, but it's an important pillar for the company. And thirdly, taking that allogeneic platform that we have in the sense of allogeneic T-cell immunotherapies, the virus-specific T-cell platform, and developing allogeneic CAR T-cells from that platform. At the ASH meeting, we have two key abstracts that describe some of those aspects. One is for Tabelecleucel, which is our initial therapy currently in phase 3. It has FDA breakthrough designation and EMA PRIME designation, and it targets EBV-specific lymphoma. That type of lymphoma is occurring, for example, in any type of immunosuppressive state, for example, after hematopoietic stem cell transplantation or after solid organ transplantation. And these patients undergo immunosuppression, and the EBV infection that 95% of the population have is going rogue and is infecting B cells and is leading to EBV-dependent lymphoma. And that type of lymphoma, which we call PTLD, can be effectively treated with an EBV-specific T-cell population. Here we have data looking at patients who have PTLD of the central nervous system, which is classically really difficult to treat because it's behind the blood-brain barrier. And these data that we have here demonstrate that in a patient population with central nervous system, EBV, PTLD, that our cells get into the brain and effectively treat that type of lymphoma. We get a 63% response rate, we get a 60% rate of patients who survive for a year, which is unprecedented in that type of disease, with good tolerability. Then for the CAR T-cell space, which is like our newest pillar, what we have here is an abstract from our collaborators, from Marco Davila and his group out of Moffitt Cancer Center in Tampa, Florida, that describes novel building blocks for CAR T-cells, and more specifically co-stimulatory domains, which will address some of the shortcomings of current CAR T-cell approaches. Namely, some of the current CAR T-cell approaches, the T-cells exhaust very quickly, and the durability of the responses is limited by what we call T-cell persistence. So T-cell persistence has emerged as one of the key drivers for durable effects of CAR T-cells, and utilizing novel co-stimulatory domains is our hypothesis, will lead to stronger activity, will lead to longer persistence, and in that sense also to better outcomes for patients.